Hello, everyone. Hello to another week with Dr. McDougall, live with Dr. McDougall. I'm Gustavo Tolosa from Dallas, Texas. And of course, it's always a privilege and an honor to host these webinars every week and have Dr. McDougall here. Most of you are regulars, but we always have new people. So I always like to mention something about Dr. McDougall, who is a physician who has been practicing medicine for over 40 years, and he is very graceful to give his time every week to be with us for free and to talk about a special topic and to take some questions from you. And of course, here are my favorite books, The Starch Solution, and the new one that just came out a few weeks ago, The Healthiest Diet on the Planet. And I encourage you to get the books. And of course, Dr. McDougall is the founder, together with his wife, Mary, of the McDougall program, which is a 10-day live-in program in Santa Rosa, California, that they host. And I cannot encourage you enough to attend. This is a life-changing program. Anyway, that's my little introduction every week. And Dr. McDougall, we're thrilled to have you here. How are you doing today?
Well, I'm having a good week. We ran a program for Whole Foods Market a couple of weeks ago, and we got a great big program starting on Saturday with 120 people from another company. And we're really looking forward to getting companies involved with what we do, because it just costs them so much money to have sick employees.
Right.
But just to replace one of the the top people in a company could cost a couple $1 million. And so we have several companies that are really thrilled with what we've done in terms of changing their healthcare costs and changing their employees and their attitudes. It gets kind of infectious, once after, when the people from Whole Foods came, they'll go back to their stores and they start telling everybody about how they lost 3 pounds, 6 pounds in 5 days and how they learned all this great stuff. And it kind of spreads. We've been working with Whole Foods markets for probably 4 or 5 years now. And it happens in the other companies that we work with too. They go back and they just, they get well, they stop having to go to the doctors, they're more productive. So anyway, we're looking forward to that next week. And we're also looking forward to taking on new companies. You and I have talked about that and make the company healthier and more profitable. Last Sunday, Mary and I and Craig, we traveled to Los Angeles to be with Jeff and Sabrina Nelson at their Veg Source conference. And that was really cool. We got to see friends like Sabrina and Mar and Zena and, all kinds of people that we've known for, many of them as long as 35 years. And so that was a lot of fun. My son, Craig McDougall, Dr. Craig McDougall, gave a talk, and I gave a talk. And when we had a panel, which was kind of cool, of different doctors like Dr. Bernard and Dr. Forrester, and got a little bit fiery there at the end of the conference. You know me, I can't hold my tongue, and I even though they're all friends, I had a few things to say to them about about how I felt about things. I have some very definite opinions. So I was given a special gift, Gustavo. I tell you, I stand on the shoulders of many, many great people. And these would be people like Dr. Walter Kempner and Roy Swank from University of Oregon, Dennis Burkett. But the one that taught me most about medicine was a fellow by the name of Nathan Pritikin. It was Mr. Pritikin. He was not a doctor, but he was one of 2 people that I could hardly wait till the next word fell from their lips. Nathan Pritikin was one. Henry Heimlich was the other. And Henry Heimlich, actually, he's still alive. And he was, when he got sick, he came to see me. It was one of the greatest honors in my life to have the man who have saved more lives than any other person, Henry Heimlich, through his Heimlich chest tube that they use in wars and the Heimlich maneuver that just dislodges usually meat from somebody's windpipe. Those are the 2 men I could hardly wait to hear the next word from. Well, one of these men, Nathan Pritikin, I did an interview on, which you can see in my February 2013 newsletter. And after he died at my age 69. After he died, his wife sent me one of 50 copies of a review that he did. Only 50 copies were ever published. And Eileen sent it to me in November 18th, 1988. And it sat on my shelf for a long time. I would refer to it once in a while when I had to know new things. I would go to see a review of medical literature on relationships of various degenerative diseases to diet and activity by Nathan Pritikin. And I'll show you a picture of it. This is it right here. This morning I sent it out. It's like 530 pages. It's free for you to read. If you want to know the basic research before the drug companies and the food companies got involved, they learned about, well, they learned in 1977 with the U.S. Dietary Goals, the McGovern Committee. They learned that they could be in big trouble if scientists stood up and told the truth. So what they did after that, after the 1980s, is they bought the journals and they bought the researchers, the industries did, and at least 70% of the research out there is done with the backing of the food and the drug companies. So to go and really find basic research where scientists did research because they wanted to know, not because they wanted to sell a product through unique positioning and say something nice about their blood pressure pill, which we're going to talk about in a couple of minutes, or nice about their cheese and so on. Back before industry owned the research, there was thousands of research papers published, and I've reviewed them in many of my books, like the one we're going to talk about today. This is a challenging second opinion. And by the way, here's a picture of me. I haven't showed the picture yet. Yeah, I have aged a bit. Mary kind of laughed. She says, "Remember that guy, Mary?"
I remember that guy.
Yeah. Well, anyway, I wrote this book when I was a young man. I was in my 30s, and when I read it, I'm sometimes amazed. But I've always been a very dedicated person, and I encourage you. We sent this out with today's review. So anyway, if you want to read the basic literature, the most concise review of the basic literature, and I do want to compare it to the book that I just showed you, because this is important also. But Nathan Pritikin, as I say, was so important in my life, and his volume of research that he did, talking about diabetes and heart disease and cancer and high blood pressure and all kinds of things. In fact, when you're going to read that, some of you are going to say, well, Dr. McDougall copied everything from Nathan Pritikin. I learned many things from him, but I did a lot of work on my own that was original. We're going to talk about high blood pressure in a few minutes. But one of the things that raises my blood pressure is somebody I've been with for 45 years. You can't hear. Yeah, you can't hear, Mary, because I only have.
That's all right.
I only have one earpiece set up.
That's all right.
But anyway, Mary went with me to Los Angeles. We had a good time together. We were with our son Craig. And I hardly ever see you during the daytime because you're always working on this silly, not silly, but phenomenal trip. So
this is a good date.
Well, it only gets really busy right before we go. I plan the trips a year ahead of time, and then right before we leave, I get all this information from people so they can choose their adventures and tell me what they want to do. And so I do spend a lot of time
at the computer.
At the computer, entering all this information into the computer so that our tour guides on Hawaii can make sure that everybody gets to do the tours that they want to do.
Gustavo, she knows everybody's name. We've been doing these adventure trips.
That's amazing.
For 25, 30 years, we've done probably 30 trips. And, we get all these, like we're having over 100 people come to Kauai. And we invite you. You still have a couple of rooms left?
I still have about 8 rooms left. So if anybody's interested, this is probably the last time we're going to go to Kauai. And it's a beautiful beachfront property. We all have ocean front rooms.
If they want, we can get them.
I have one garden room left.
That's right.
But they're ocean front rooms right on the beach. The food is fantastic. And
that's why we're going back.
One of the reasons we're going back is because the chef was so creative and did such a fabulous job of the food, and there was so much variety, and it was all so good. It was amazing. And so I have about 8 rooms left, and I can't get any more.
Okay.
That's what they've told me. There are no more rooms left after those 8 go. So if anybody is interested, please sign up soon or you'll miss your chance to go to Kauai with us.
And that's the end of January 2017.
Yeah.
In case somebody's watching.
And they can sign up on the website, right?
You can sign up on the website, yes.
Or you can call the 800
Or you can call the 800 number and talk directly to Carol.
Yeah, it's 800-941-7111.
7111.
3 ones. You talk to Carol.
It's going to be a really fun trip, and I'm really glad that you're joining us, Gustavo.
Yes, I'm very excited, and I am looking forward to it.
The fact that we have so many good friends that come back with us twice a year often.
Yeah.
It speaks loudly of all the work you put into this.
I suppose so.
Really, I hardly see her all day. She's just, anyway, she will know your name.
I might not know you by face, but I will know your name.
Yeah, and I'll say, who's that, Mary? Anyway, it's a fun trip. And they'll appreciate all your hard work when they show.
I'm sure they will. And they'll love the resort.
And people can actually have time to visit with you, right, Dr. McDougall and Mary?
Well, yeah, I'm there all the time. I only give 1 lecture a day. But we have a chance to get some good conversations going with people. We offer no medical care, even though I do have a Hawaii medical license.
Right, you do.
Yeah, I do. I still try to maintain my license since 1973. I got my license. But we don't practice any medicine there. If you are already a patient, I certainly can legally help you. But if you want medical care, you have to come to our clinic in California. But if you just want to have a great time.
Well, we sit and we try and vary who we sit with at dinner and at lunch and at breakfast. And so we have a chance to talk to everybody and be with everybody.
Plus the 3 grandkids are coming.
Oh, yeah. Heather and her husband and our 3 oldest grandsons are coming along this time.
And maybe my brother, who's a doctor, maybe my brother and his 2 children. So there are going to be a lot of McDougalls there. And the 3 grandkids are actually Wilsons. They're Heather McDougall and her 3 kids, which are Jason Ben and Ryan Wilson. They'll be there. And we have
other kids going this year too, which is really a first for one of our winter trips. We have several other children, and they're all going to be about the same age, and so it'll be kind of nice to do the adventures together with the other kids.
Yeah.
Oh, well, and that is January 28th through February 4th.
Yes, I suppose I just go where I'm told to go.
What was the question?
What the date was?
January 28th to February 4th.
Yeah, she's got it.
Yes. Dr.
He's going.
He's going. He's got reservations already.
Dr. McDougall, does your brother is a physician as well, right?
Yes, my brother's a board-certified internist. He helps us out with programs like the whole food programs that we had last a couple weeks ago, and the new program starts on Saturday. We have actually 6 physicians that are working, 6 all next week, taking care of a huge group of people. But that's a medical program based on from a company that's sending some of their key employees to us. Kauai is just a lot of fun. And I guess I was going to talk a little bit about high blood pressure today. You said I've been at this for 40 years. Actually, I've been at it for 48 years. For 49 years. And I was taught to, just like other doctors are taught, to treat high blood pressure, which is a sign, by the way. I've never seen anybody die of high blood pressure. It's just a sign of the body being sick. We're supposed to treat this sign. Another sign would be cholesterol and uric acid. And, there are many signs, but we were taught to treat these signs with medications. Nobody dies of high cholesterol, but we use statins. Nobody dies of high blood pressure itself. Well, I got to qualify that a little bit. But instead of treating the underlying problem, so what we do is we treat the sign and make the blood pressure go low. And as a medical doctor, I can make your blood pressure as low as I want. I have such powerful drugs at my hands to use on you. I can make your cholesterol. I can make it 1 international unit or 38 milligrams per deciliter with enough statin. I can do that. Or I can take your blood pressure and I can make it 60/30 with the medications. So I can treat the signs, and that's what's being done. But what you want to do is treat the underlying problem. High blood pressure, used to not exist in certain parts of the world. And if you read the Nathan Pritikin review, you'll see a thorough discussion on where high blood pressure didn't exist amongst millions and millions of people when people lived on a starch-based diet. Now, the exception is in parts of the world that live on a starch-based diet where they, 3 or 4 times as much salt as we do, like in Japan. They had, and probably still do, a very serious epidemic of high blood pressure from all the salt that they ate. And they had strokes back in the 50s and 60s. And they had strokes. They didn't have heart attacks, but they did have strokes from the high blood pressure. Heart attacks were very rare. And so you can get high blood pressure from eating very, very large amounts of salt, I believe. But the underlying cause of high blood pressure for most of Americans and Europeans and Australians and people in New Zealand is not the salt. Salt is something you want to pay a little attention to. Well, let me just summarize. If you lower salt by about 1,700 milligrams, which is almost a teaspoon of salt, you make a drop in blood pressure of about 4 or 5 millimeters on the top and about 1 millimeter on the bottom. So not much drop in blood pressure by lowering your sodium intake to 2,300 milligrams a day, which is what's recommended. Now, you can really, really lower your blood pressure a lot if you get it down to, say, 500 milligrams, which is the Kempner diet I've talked to you about in the past, Walter Kempner from Duke University, where they use the rice diet. He used to actually wash his rice with the idea of getting more sodium off of it. So anyway, salt can be a factor, but let's just leave this alone for a minute. You've all heard, in fact, that's all you've heard about your diet is to eat low sodium. That's all you've heard in terms of dietary change is to eat low sodium. But what you should be told instead is that your blood pressure is up because you're eating poisonous foods and your blood vessel system is in trouble. That's what's happening. What's happening is because of the animal foods and the oils you're eating, your cardiovascular system is sick. And as a result of the sickness, peripheral resistance to flow is increased. In other words, it's hard for the heart to pump blood to the tissues. Are you hearing me okay, Gustavo? Good. It's hard to pump blood to the tissues. And the reason for this is the foods we eat, they cause sores in our arteries and scars. And so you get all these blocked arteries with hard fibrous plaques and also soft volatile plaques. So you get the actual pipes kind of filled up. And then the other thing that happens is the walls get stiff on the arteries because of the high fat, high cholesterol diet. And so they're not elastic. And when the heart pumps, it's pumping into a stiff tube. And as a result, blood pressure goes up. And one other thing that happens is when we eat a fatty diet, and that doesn't mean a lot of fat, that just means the typical amount of fat that the American eats, it causes the blood cells to stick together. You've probably seen that video. I showed it many times, where the blood cells stick together in clumps. And actually, this clumping gets so severe that it's called rouleau formation. And so you have these clumps in the blood vessels, and the heart's trying to pump blood to the tissues through all this blood sludging or clumping, the spasms that occur as a result of what we eat, the stiffness of the arteries, and the blockages. And so the heart's trying to deliver nutrients to tissues, and you have all this peripheral resistance. And the option that the body has, one of the major options it has to increase flow of blood is to increase the blood pressure. Just like if you had a plugged up oil system in your car, the oil pressure would go up. The same thing happens in the body, is because of all the plugging, is the blood pressure has to go up. It's normal, it's natural. Now, there is a certain level of blood pressure that should be treated. Certainly, if the bottom number is over 105, it should be treated, because we've demonstrated through small studies that were done back in the 1970s that taking people with malignant hypertension, that means blood pressure where the bottom number is 105, 115, 120, who are at high risk of strokes and high risk of heart failure, if you treat them with blood pressure pills, and what was used back then was chlorothalidone, which is a diuretic, which is what I still use today, you'll dramatically reduce the risk of death, heart attacks, and strokes. These are people with severe malignant hypertension. They need to be treated. that's not the bulk of people that have high blood pressure. Most people who are told they have high blood pressure have what is called mild hypertension if it's properly diagnosed. And the way it's properly diagnosed is by taking your blood pressure at home, not your blood pressure in your office, in the doctor's office. That means how afraid you are and anxious you are of the situation. So if your blood pressure at home, when you take it with your blood pressure monitor, maybe once a month or twice a week, certainly not every day, you take it, you write it down, and if the bottom number is below 70, that's considered, excuse me, above 70, it's considered mild hypertension or pre-hypertension. When it gets to 80, the bottom number, which by the way, about half of people have, is a bottom number of 80 millimeters of mercury, then you're considered to have high blood pressure because you have twice the risk of dying of heart disease with a blood pressure of 80. But that's not because the blood pressure is hurting the blood vessels, it's because your blood vessels are all sick and you have a higher risk of dying. It's, I hate to use the analogy chicken and egg, but it's the one that comes to mind. You know, they've got it reversed. That high blood pressure reflects a very sick cardiovascular system that's ready to shut down either through hemorrhage or plaque rupture. So when you get to a blood pressure of 90, bottom number, 90 millimeters of mercury, most doctors would agree you have high blood pressure. The Joint Committee on the Treatment of High Blood Pressure, which, by the way, they started in, I think, 1971. I talk about it in the book. But the 8th Joint National Committee, which came out in 2014, this is the official committee of the U.S. on what you should treat for high blood pressure. They say for people over 60, you should consider treatment if their bottom number is 90 or higher. Please note that or higher, because, you know, it's really kind of confusing to the scientists as to what treatment is best, where you do more good than harm. Now, the National Health Service, which is the British guidelines I've been using, I've been actually showing it to people since 2004. The National Health Service in Britain, they recommend initiating medication if the blood pressure is 160 over 100 millimeters of mercury for a very long time, in other words, sustained. And the Cochrane collaboration, when they reviewed the data on treating high blood pressure, they couldn't see much benefit in treating people with blood pressures lower than 160 over 100. So there is a level, let me just kind of give you my general guidelines, where I do treat high blood pressure if it's diagnosed by taking readings at home and taking them into the doctor. In this case, it would be me. And if your blood pressures are usually, you know, average 160 over 100 or greater, I'm going to treat you. I don't want to hear about your blood pressure going up because you broke your leg or because you're anxious about coming to see me. That high blood pressure needs to reflect a sick cardiovascular system. And if I treat you with high blood pressure, say your blood pressure is 160 over 100 or greater, and I treat you, what I will use is a time-honored diuretic called chlorothalidone. It's not the same as hydrochlorothiazide. These are different drugs. They're both diuretics, but chlorothalidone has been tested. It's more powerful, more effective. It also can be purchased at Walmart for 30 pills for $4 and 90 pills for $10. So it's not a very popular drug, but it should be. I mean, many doctors out there that really know how to treat high blood pressure, we use chlorothalidone for their patients. I used to use beta blockers. I don't anymore. They haven't been proven to be very effective in terms of reducing heart attacks or strokes. I almost never use ACE inhibitors, which are, they cause chronic cough. They can cause kidney failure. The research is in the paper that I ask you to read. I never use calcium channel blockers. They're just too darn dangerous. They increase the risk of dying of heart disease, cancer, suicide, cause constipation. I mean, they're just too much harm for any theoretical benefit. Now, why are these drugs popular? Well, I started this, I told you, almost 50 years ago, and what we had were diuretics. Actually, what we had before that was Walter Kempner's work, the rice diet. And then they discovered diuretics, and they said, why go on such an extreme diet? And it is an extreme diet, a diet of rice and fruit juice and table sugar. But his patients had very severe malignant hypertension. I mean, these people had blood pressures of 220, 240 over 120 to 140. Well, anyway, we started out having these diuretics, chlorothalidone being the classic one, and we could lower and we could help people, as I told you in the beginning, with these very severe high blood pressures with these diuretics. Well, you know, they were cheap, they were generic, became generic, so they developed hydrochlorothiazide, but I forget what the brand name was, and that became what the sales people, primarily sales ladies, drug sales ladies, came in and pitched the doctors back when I was young. We wouldn't use chlorothalidone because it was generic. We'd use the brand name hydrochlorothiazide. So that got started. And then, you know, that became generic. And then we had to invent, you know, push something else on the public and the doctors. And then it was beta blockers. And next it was calcium channel blockers. You know, as something becomes generic, the drug companies have to invent something that they can sell for $2 or $3 a pill instead of pennies a pill, so they can keep their profits up. Now, the only criterion that you have to be a blood pressure pill, other than not outright killing your patients, is you just have to be able to lower blood pressure. You don't have to show that they have less stroke or less heart attack with this particular medication, which has been shown, by the way, with chlorothalidone, as I showed you. As I told you, all you have to do is show you can lower blood pressure with a drug that's, you know, relatively safe, and then you get approved for market. Anyway, I will treat patients with chlorothalidone if they have a blood pressure 160 over 100 or greater, and I'll try and drop it to about 140 over 90, but certainly not lower than 80 millimeters of mercury. Because when you overtreat blood pressure, what happens is you decrease perfusion pressure to the tissues. With medication I'm talking about. If you overtreat and you treat, say, to a diastolic bottom number less than 85 or 80, you increase the risk, you double the risk of stroke compared to 100 millimeters of mercury. You double the risk of stroke, and you as much as 4 times increase the risk of dying of heart disease by overtreating, because the perfusion pressure that was created because your system's all clogged up, that perfusion pressure gets knocked down by feeding various poisons to the body. These drugs that I mentioned are properly named. This is not done for any particular emphasis, but the proper name for these drugs is they're poisons to the system. And so when you give beta blockers, you poison the heart, which makes it weak. You give calcium channel blockers, you poison the blood vessels, which prevents the blood vessels from contracting, they relax. When you give people ACE inhibitors or angiotensin receptor blockers, which I'll never prescribe angiotensin receptor blockers because they dramatically increase the risk of dying of heart disease, but they poison the adrenal glands. If you give diuretics, they poison the kidneys. So you give these various poisons and you lower the blood pressure, but be careful not to lower it too much. I think I'll end this conversation by really telling you what I should have told you a long time ago, which is the way you want to treat high blood pressure is you want to change your diet. We have data that's published. It was published in the Journal of Nutrition. You can go look at it. We have data that was published from Oregon Health and Science University that shows the effectiveness of the dietary change that I prescribe in terms of lowering blood pressure with people with blood pressures, say 150 over 90, those that need to be treated, you know, by most doctors' practice, say 150 over 90. We lowered the blood pressure about 18 over 11 millimeters of mercury with just diet. You know, we've done various studies that have shown about that kind of drop in people with what is classified as high blood pressure, so you no longer have high blood pressure. And by doing it this way, you've treated the underlying problem, the sick cardiovascular system. So you will get dramatic reductions, I believe, and I believe the science supports me, and I believe if you read the reviews by Nathan Pritikin, you'll see the same research. When you fix the problem, which is the poisonous food, the animal foods and the oils, is not only does your blood pressure come down and you get off blood pressure medication, we reduced or stopped blood pressure medication in nearly 90% of people in the paper we published. Not only do you reduce blood pressure, but you drop your cholesterol. We dropped cholesterol an average of 23 milligrams per deciliter in 7 days. No medication. We're talking about simply dietary change. You lose weight. Our average weight losses are 3.1 pounds. And every doctor will tell you, hey, you got high blood pressure, you got type 2 diabetes, just lose weight. Well, you can't lose weight unless you fix the problem. The problem's the food. So you get a good bowel movement, the indigestion goes away. So that's the way I want you to treat high blood pressure. Now, if you make all those efforts and you still have a blood pressure that's, say, 150 over 90, 160 over 100. It's a judgment. It's kind of a guess. I usually guess when it's 160 over 100. I'll put them on medication. Other doctors may guess at lower levels, but don't overtreat. Then you do need to take advantage of chlorothalidone. And hopefully, I say to myself every time I prescribe it, which I do, maybe one or two patients each program, I'll prescribe it. And I think to myself, and I look at them, and I say, at least in my mind, I say, if I don't say it outright to them, and I usually do, and I hope I'll end up doing you more good than harm by what I'm doing. And you want to put all your emphasis on food and a little exercise and get some sunshine. Sunshine lowers blood pressure too. You want to do the no cost, no side effect things first, and then take advantage of medications and realize they all have risks. Now, I did want to talk about one other thing. The goals of treating blood pressure have been changed recently. In a study, a randomized trial of intensive versus standard blood pressure control that was published, it was the SPRINT study, a research paper that was done. And it was actually released, before the paper was released, it was released to the press, which is unethical. Finally, the paper was released, and it showed a small reduction, an absolute reduction of about 1.62% of cardiovascular disease, 1.62%. When you aggressively treat people and make their bottom number lower, say, or the top number, say, make it 120 as opposed to 140, and the bottom number lower. So they had a 1.62% absolute reduction in risk of dying of heart disease. You got to treat 62 people. Anyway, it was overblown as to the benefits, and they didn't talk anything about the side effects until the paper came out, which were hypotension, too low blood pressure, fainting, electrolyte imbalances, acute kidney injury or failure, were higher in intensively treated people. So, now you're going to get pitched, because of this paper, the SPRINT study, you're going to be pitched to be more aggressively treat your high blood pressure. I want you to know that I know that's wrong. I can show you major studies that have been done over the years, but they don't get a lot of attention, which show an increase, as I just talked to you about, in your risk of stroke and heart attack when the doctor too aggressively treats your blood pressure and lowers it down to normal, say 70 millimeters or 80 millimeters of mercury, which this paper addresses. The bad effects, the stories that are harmful to the business, to the doctor business and the drug company business, don't get much attention. Now I'm going to end with one last thing, and then I'm going to let you ask questions. I don't know how we're doing on time. Yeah, when many have told some of you this. When I graduated from my residency, I'm a board-certified internist, and I graduated from my residency program at John Birch School of Medicine at the University of Hawaii. My chief of medicine, Irv Schatz, called me into the office after I had my ticket, my degree, and he told me that I was not going to succeed with my crazy ideas about a vegetarian diet, that my family was going to starve to death. And I told him that's not true. I'm going to be very successful, and I'm going to get people who are very successful to follow me, people with good jobs, good educations. They're going to look at themselves and they're going to say, why am I so fat? Why am I so sick? And the reason is you don't have the information that I have to offer you. And once you hear that information, you will apply it just like you did to building your business, getting an education, finding your spouse, raising your children. You're going to put this effort into fixing the problem, is what I told her Schatz. But what he was really trying to tell me, I didn't realize that until I left the office, was I wasn't playing the game. As a general doctor, what you do is you collect a whole flock, school, group of patients, and you get them on a bunch of pills, like blood pressure pills, cholesterol pills, diabetic pills, and then you have them come back it used to be every month you had to come back. Now it's less. But it used to be every month the patient had to come back. And why did the patient have to come back? It's so the doctor could ding him for an office visit. And so if you collected a group of maybe a group, a flock of maybe 500, 1,000 patients, you've got yourself a really good business, because you get them hooked on these drugs, which may do some good, but certainly do some harm. And one harm is you now are totally involved in their life. They have to go back for refills, and they're worried about their blood pressure, and they're checking their blood sugar all the time. And you've really done a lot of terrible things to these people by getting them hooked on the drugs. Maybe you've done them some good, but you've done a lot of terrible things. And you've got them into the system. You've got them worried. They're thinking about their medication or the doctor's appointment. They're not thinking about their children or the next soccer game. And it's just a very horrible thing that's been done. And it wouldn't have been done, I think, if Nathan Pritikin had lived past my age, past 69, if he may lived to be 79 or 89, because he was so strong. He would have stood up to these drug companies and the food companies, and he did when he was alive. Extremely powerful man. Go see the interview in my February 2013 newsletter, Meet This Man. And then if you're interested, you're, say, a dietitian or a clinician or a physician, and so on, and you want to read the phenomenal work he did, I put that out today. It's all for you. And I hopefully there are no negative consequences to me publishing this very important document. But Mary and I talked about it and thought about it and said, it's our obligation to share the genius writing that this genius did. And anyway, it's there. Get the problem fixed. Take the drugs if you need them, and eat good food, which is starch, vegetables, and fruits, and not animals and oils, and go for a walk, get some sunshine, and get the medical business and pharmacologic business out of your life.
So for
that's
these,
what I have to say.
Okay, that's very concise and clear, Dr. McDougall. For some of the people that are kind of new here in the group, would you just say a little bit? I think we talked in our last webinars how you and me and other people have been eating this way for a long time, and we assume that it's easy. And but would you just say in a minute or so what it is that you recommend when it comes to diet?
Yeah. Yes. Well, as you showed, you showed two of the books that I've written. Mary and I have written 13 together and separately, 13 national best-selling books. But everything you want is free on the website, and no one has ever said that I was misleading them when I said everything's free on the website, because it is, including the papers on blood pressure and now the Nathan Pritikin document, and probably 500 recipes. We have over 1,000 recipes in an app that is for the iPhone. Right. People love the app, and I think that's $5. Anyway, there's whole kinds of resources for you, but what you need to do is you need to eat a diet based on starch, like everybody else used to do. The Aztecs and the Mayans, they lived on corn. People in South America lived on potatoes. People in the Far East lived on rice. I mean, there are lots of, I could probably go through 100 different starches, identify 100 different starches that 100 different cultures have consumed, but it's always been a starch-based diet. That's what you eat most of. Then you add some fruits and vegetables. We use a little salt on the top of the surface of the food. We also use a little simple sugar on the oatmeal to make it taste better. We use your favorite spices. So it's a very, very tasty diet. And you can make it monotonous. By the way, I met Andrew Taylor last weekend at the conference in Los Angeles. Really, really nice man. He's going to be at our next advanced study weekend in February. He's called the Potato Guy, and he's lived on for more than a year, just basically white potatoes. He's got a new little book out that's really cool, and he's lost about 120 pounds. And so I had a chance to meet him last weekend. So you can make the diet as simple as potatoes and water, sweet potatoes and water. Or you can, you do have to add a little fruit and vegetable if you're going to make it based on grains or legumes, because they're deficient in A and C. So you'd say, if you wanted to, you could eat the bulk of your diet as rice with a little bit of fruit and vegetable. Yeah, you could make it simple. Or Mary has published probably 4,000 recipes. And what we do is we eat the same thing over and over again. We find a few things. For example, next week, and also 2 weeks ago, we served at the business programs that we're running, we served a pea soup. And you had that pea soup, Gustavo, when you came to the clinic. You probably had it at the advanced study weekends. Pea soup is so amazing that you could make a pot like, that big, and you could have pea soup and water for the rest of your life. It's that simple. Or you make almost any of the soups and just eat that and water, or that and potatoes and water. And it's so stupid simple, considering all the pain and suffering, medical expense that goes on with heart attacks and blood pressure pill treatment. I must get 2 or 3 letters a week from women with breast cancer, and a couple letters from people with colon cancer and kidney failure. And oh my goodness, how much trouble is it to eat potatoes? You know, when some of you when you get on an airplane, you have to ask for a seatbelt extender. You know, compare that to eating oatmeal in the morning for breakfast. Or, yeah, it's really, really that simple.
Right.
And the benefits always occur. You know, it's just like when you quit smoking, your lungs always get better. But anyway, there's a lot of resource there. Some of you will have to be more salt restricted, but it's very few of you. And some of you can't take simple sugars because they raise your triglycerides and you have other, but most of you can. And you just eat a lot of food.
Right, right. Dr. McDougall, is there such thing as, I'm sure there is, as someone having too low of a blood pressure without medication or anything? And is that dangerous, or have you ever seen anything?
No one in good health. I mean, if you're bleeding to death, you just got hit by a bus, you know, you could have very low blood pressure that's quite dangerous. Right. But under normal circumstances, a person that's walking around, you know, looks relatively healthy, there's no such thing as too low blood pressure. Blood pressures in cultures that eat the way I recommend will, you know, often run 90/40 millimeters of mercury, or, you know, yeah. So lots of people have blood pressures that would be considered too low by Americans because their average blood pressure is 120/80.
Right.
But health, you know, outside of having some, you know, drug toxicity or bleeding problem or something like that, no, there's no too low level of blood pressure, or it's extremely rare. Let's just put it that way.
Right, right. And what would you say to some of the people here are commenting that they're on medication, and the doctor, of course, has told them that they will never get off of these medications? So.
Right. I had a chance to look at this book that I wrote almost 35 years ago. And nothing needs to be changed. But in that, the chapter on high blood pressure, I actually gave you instructions to work with your doctor on how to do it, on how to reduce medications. Let me just kind of show you this picture. This is the peripheral resistance. Look at that. That's like the hose being squeezed.
Right.
See, it's a garden hose being squeezed. The pressure goes up. I wrote that 35 years ago. But in here, it also talks about step down on your medications. It's on page 192. And I explained to you how you reduce the medications and which ones to start with. And you know, of course, talk this over with your doctor, but this is how I do it. Just like the article I wrote on, which you want to continue on, an updated article, that was 35 years ago. But I wrote a newsletter article that I ask you to read now. It was November 2009. And that's free. It's on our website. It's how I treat patients with elevated blood pressure. So that's an update. And there really is no need to do, I wrote something about the SPRINT study when they came out a couple of years ago, a year ago or so. But the truth is the truth. You'll find similar discussions in the literature review by Nathan Pritikin. You look at Walter Kempner's work. I mean, it's all the same. It's just that money buys the message.
Right, right. Well, Dr. McDougall, this is, you know, quite the way you put it is wonderful, because it's a very simple approach. And
yeah, so we're treating signs of disease: high cholesterol, high blood pressure, high blood sugar. And when you treat signs of disease with dangerous drugs, you may get little benefits, but you get terrible, terrible adverse effects. And that's why it's wrong. But it's the only tool in most doctors' tool bag is pills. So even though their intentions may be good, they may really want to see their patients get healthy, and they do. I know they do. There can't be anything more rewarding than what I experience, and many other doctors listening out there experience, and that is to have a patient come back and say, look at me, I'm off all my medication. I've gotten 2 emails this morning already of people that have lost more than 60 pounds. I don't take my diabetic pills anymore. I can have, because I'm off the drugs and I feel good, I can have great sex with my wife. They got to get real personal. But you know, to have a patient come back and say, you know, I can see you watching my children growing old enough to have grandchildren. What a reward. But we don't have that trick in our tool bag because it's not taught in medical school. It's not pushed by the drug companies. You know what they push. And you suffer as patients. You suffer. I mean, there are those of you out there saying, "I'm going to eat my pepperoni pizza and my chocolate malt shakes, and I'll just take the drugs." Well, fine, you can do that. That's up to you. But you ought to have an option. And there are other people out there that are saying, "I would do anything to have a few more as I put it, I'd do anything to have a few more candlelight dinners with Mary, to have a few more days playing with my 7 grandchildren. I really would. I know it's not easy to change. I'm not trying to tell you I'm perfect either, but some of you out there really want this so badly, and you're not given the opportunity. But this is a real opportunity. It's free,
and you see it when people attend your 10-day program. By even the 5th or 4th day,
right?
It has
the average drop in cholesterol. And again, this is published data in our 7-day program. It's in I think the October 2014 Nutrition Journal. You can find it on our site. We published our data on 1,615 people in 7 days, showing these absolutely tremendous results, which, by the way, no one has argued against, because it's true. And by the way, Nathan Pritikin published a similar paper on about 4,500 people in the, I believe, early 90s or late 80s. So it's not just myself who's made these wonderful discoveries. These have been discovered, these have been known by many people. And I bring up Nathan Pritikin as one of my most important mentors. It's up to you to do this, because there's no financial advantage for somebody else to help you do it, except, like I say, a couple of weeks ago, we ran a Whole Foods market program, and starting on Saturday, this Saturday, which will be, I don't know, this is October 2016. Starting this Saturday, we'll be running a huge program for a huge company. And the reason they do this is they like their employees, for sure, just like Whole Foods. They really value their employees, but they also have to pay the bills. These are self-insured companies. So if you can get to the guy or gal who writes the check and says, look, you're spending these tens or hundreds of millions of dollars on useless heart surgery and chronic coronary artery disease, and on diabetic treatments, and on cesarean sections that could be avoided. You're spending all this money that could, when you get the balance sheet done, you could end up being 2% or 10% more profitable. So those are the kind of people that buy into our message, because they can see it. They want functional employees that aren't thinking about their bowels all day long. There was actually a study done, I'd have to look for it, where they interviewed employees, and I'm not giving you the correct figure, but it's close enough. And 40% of their employees were thinking about their bowels, I don't know, during an 8-hour period of time, so many hours of the day, because their stomach hurt, and they hadn't had a bowel movement, or they were having diarrhea, or so when your employee is thinking about their intestines or their next doctor appointment, you're losing productivity.
Right.
You want your employees as healthy as possible. You don't want to lose them. Yeah.
Dr. McDougall, one more question, then we'll close. Have you ever seen a case where putting a patient on blood pressure medication has caused some sort of irregular heartbeat?
I have. This is a reported side effect, particularly of diuretics. Yeah.
Oh, okay. All right.
Yeah,
so
this is not. Oh, sure. These medications have many side effects, and you, as a person living in the 21st century, you can look this up. You can go to Google. You can go to the National Library of Medicine. You can go to the prescribing information of the drug company. And this, of course, was very disconcerting to doctors. I've been in, I told you, this business almost 50 years. Back when we started, patients were treated as cattle. They're treated as stupid, as stupid and disinterested. We actually are taught. I'm not joking with you. We were taught, or at least that's what I learned back in my early education, that you shouldn't bother talking to people about diet. You can barely get them to take their drugs. They're too stupid. We're taught to think about people this way. They're too stupid and disinterested in themselves. They're barely smart enough to take the pills I prescribe and to sign the check at the end of the office visit. So why would I ever talk to you about a diet? And that's the attitude that I was raised with. And I bet these days there are a lot of doctors who feel the same way. They shouldn't. They know much more about good nutrition. Many do. And the patient deserves, even though it doesn't fit well into your 7-minute office visit. See, in 7 minutes you can write a prescription, out of here, we'll see you in a month.
Let's see you.
Look how many people you can see. It may take you a lot of effort personally or with your assistants to teach people this very basic dietary change. So it's not profitable. That's the problem.
Right. Well, I want to encourage people to send questions always to webinar@drmcdougall.com, because we have someone who goes through the questions and selects them, and then they send them to me so I can ask you the questions. So that's webinar@drmcdougall.com. Well, thank you again, Dr. McDougall, for being here this week. And next week, I think we have a topic of diabetes.
Oh, is that what we're going to talk about? I'll be here next week, okay. And I guess Dr. Lyle did a great job a week ago or so ago.
Oh yeah, that was very good, very good. And everybody, make sure that you check your email, because we are sending you each chapter from
this book right here,
medicine, from that book. So,
and I will tell you honestly, it was like maybe 35 years ago I wrote it. My picture.
And you can prove it.
I read through here and I go, my goodness, how did I ever learn these things, and how did I ever write this?
Right.
And I think back that I had such a curiosity, and of course Nathan Pritikin and Walter Kempner, and I really wanted to help my patients out, like all doctors wanted to do. But I just saw so much misery and suffering. And any of you who are patients, or any of you who are clinicians or nurses or dietitians, you know exactly what I'm talking about. So I put this book together, and I don't have to change. I don't think I have to change a word. It's on arthritis and breast cancer and osteoporosis and heart disease and heart surgery. 35 years later, I don't think there's a word I'd have to change. I think I've written my last book.
I wanted to mention something. Last night, I did a webinar with Chef AJ, and the topic.
Oh, yeah, she was there last week.
Yeah, it was last night, and it was the topic was 7 strategies for surviving the holidays. So she really did a great job, and it's a free webinar. And I just wanted to let people know that if they're going to struggle with that.
She also sent me this.
Yeah,
which is from my water glass, which is potatoes. These are potatoes. Yeah, AJ, right. An amazing person. If you haven't gotten to know her,
she really is. And the webinar is on her webpage, which is eatandprocess.com, and it's free. So everybody that wants to watch it, I think, is going to be very useful.
Yeah, and as a parting word, I would ask you to share our work, our website, which is basically free, and our webinars, and pretty much all the information that we have there is free. I want you to share it with your friends and relatives, and it may be hard to do, especially when you're meeting over a cheeseburger.
That's right. Well,
it may be a little threatening, but there are some people who want to be well.
And they're looking for a way, and they don't know. And actually, your 10-day program really is on your website for free.
It's all there. Everything's there for free.
Right.
But we do want to encourage you to let us lock you up, which we will be happy to do.
Right.
You will have a wonderful, amazing time. We'll lock you up with probably 30, 40, 50 other people. And we have a staff.
It's fun. Yeah.
Are very dedicated. And we also I see all the patients still, and Dr. Anthony Lim sees all the patients. And as I say, our results are we get close to 90% of people to reduce or stop their blood pressure and diabetic pills and many, many other medications. I should just have a trash bag sitting next to the office table.
Yeah,
because and then what we need to do is take these drugs. We need to take them to the pharmacy that has special toxic waste disposal. There are only a few pharmacies that will take your drugs and they expose them as toxic waste. So you don't want to throw them down the drain.
Right. I know.
They're poisoning the fish and it's not a good thing. Yeah. So take them to your pharmacy. Take your supplements that you waste your money on to a pharmacy in your town that processes these medications environmentally safely, disposing them as toxic waste.
Well, thank you again. We'll see you next week, Dr. McDougall.
We'll talk about type 1 and type 2 diabetes next week. And
very good. And everybody else, we'll see you then. And we have the registration on your website, so you can go and register right now.
Yes.
All
Take
right.
care. See you
Okay.
next week.
Goodbye.
Bye-bye.